Hello, my name is Ben Thompson, audiologist and founder of Treble Health. I focus on tinnitus, and you're here on my YouTube channel watching this video, which will ask the question, does insurance cover tinnitus treatment, and what you need to know about insurance in regards to tinnitus care? The first time you may be asking this question is when you're seeking medical help for tinnitus. And for anyone who develops tinnitus or notices ringing in their ear, one ear, both ears, high-pitched sounds, any type of sound coming from your head that's not actually there. If you have any of those symptoms, then I would recommend going to an audiologist or an ear, nose, and throat ENT clinic to get evaluated. That would start with a hearing test. And that's going to be the first time that you consider insurance and who's going to pay for these services. If you're new here on my YouTube channel, you can subscribe for more videos about tinnitus. Before we go deeper into today's topic, I'd also like to introduce a new project I've been working on called the Tinnitus Quiz. If you're looking for relief from tinnitus, then head over to tinnitusquiz.com, answer a few simple questions, and you'll be guided into the next step in your journey to tinnitus relief. It's simple, it's free, and it's something that I've put my heart and soul into creating. So head over to tinnitusquiz.com to learn more. In terms of insurance coverage, let's talk about that first appointment. The first appointment is typically comprised of a hearing test, which will evaluate your ears for any blockages of sound, and it will try to find the cause of your tinnitus. Is it coming from earwax? Is it coming from an ear infection? Is it from a hearing loss or something else? Hearing tests will be covered by insurance in most cases, and that's something that typically has little to no copay associated with it. If you have Medicare, for example, then the hearing test is covered at no charge to you. That applies to a general hearing test, or if you seek help from a tinnitus expert at a clinic, they may do some specialty tests like otoacoustic emissions, OAEs. Once you've gotten the hearing test, hopefully you've been educated on your options for tinnitus. Just so you know, there are real solutions for tinnitus, and you can get help with an expert who specializes in tinnitus. What we see is that after time of following a treatment protocol, that the tinnitus levels can come down to very manageable levels. And that's the goal, to live a full and productive life with tinnitus. So for 99% of cases, there's no surgery or medication that solves the problem. In most cases, we have a solution for tinnitus based on therapies, treatments, and management strategies. That's what I focus on. That's what this YouTube channel provides a lot of free information for. And we have a nationwide telehealth service at Treble Health, which helps individuals over Zoom and with medical devices shipped to the patient's home. So if you're in that consideration stage of, okay, I've gotten my hearing test, now what? Does insurance cover tinnitus treatment? Well, a big part of tinnitus treatment are often tinnitus maskers. Those are, technically speaking, hearing aids. And when those are programmed well for tinnitus, they can help provide significant relief. In my experience, insurance companies rarely cover tinnitus treatment. However, if yours does, then, for example, my team of audiologists, if you worked with us, what we would do is we would provide the proper documentation for you to submit the services and the medical devices that we work with to your insurance company and ask for reimbursement. They would need the diagnosis codes and the service codes. And that's something that myself, our clinic, would definitely be able to provide to you. And if you similarly went to a local tinnitus specialist, a tinnitus audiologist, then they could provide similar documentation.
This is a short interruption from today's video to announce the Tinnitus Quiz. If you're watching this video, there's a good chance that you or someone you know has tinnitus. We know how much tinnitus can impact your daily life, and we're here to help. Visit tinnitusquiz.com and take a 2-minute quiz to receive personalized treatment plans that have helped hundreds of people learn to manage their tinnitus. Start now at tinnitusquiz.com.
Some insurances do cover hearing aids, and now we'll go into that piece of this. Those hearing aids can be used when programmed properly to help reduce tinnitus, so that's why we're going to talk about this here. There's a pretty wide mix of plans that provide specific dollar amounts, for example, $500 or $1,000. There's also certain percentages that they allow, for example, 90% of the allowable amount. That does not match the audiologist price. So in most cases, you would pay a portion of the cost for the tinnitus treatment, and the remainder of the cost would be submitted by your insurance. So again, majority of times, the insurance does not have a benefit for tinnitus treatment, does not have a benefit for hearing aids, But in those cases that they do, then we do want you to max out the insurance benefit, of course, to have your insurance pay the most that they possibly could so you can get the best care that's out there. Oftentimes, the only way to really know what your true benefit is to either on your own by calling your insurance company and asking some questions, or by working with the audiology clinic or the audiology service like Treble Health or another one that you're interested in working with, and seeing if they can run your benefit check. It's something that we do all the time. It's really simple for us. We would just ask for an image front and back of your insurance card, and then we'd be able to contact the insurance company on your behalf to understand what your benefit is. Oftentimes, the only way to really know what is the full coverage will be to submit that with the insurance company and then see if there's any specific requirements or deductibles to understand the exact percentages and really estimate the benefit that you would get from your insurance company. The difference then would the remaining amount of a treatment would be what you're due. So for example, if say you were working with Treble Health and our tinnitus treatment cost was about $2,900. Let's say that your insurance company paid $1,000 and that was the allowable amount, but then they only had a specific percentage that was allowed, say 90%. So in that specific example, your insurance company may pay $900 on the treatment and you would need to pay the remaining $2,000. I would say that would be a very good outcome. And if you have some sort of deal like that, then you should definitely use it and proceed with it. That process can often be a bit murky or complicated. So just work with the audiologist that you plan to get helped by. If that's Treble Health, our team, if that's another audiologist, just make sure you provide the necessary documentation. Typically, it's only your insurance cards and your ID that's needed. Sometimes the insurance plan that you have works with a third-party administrator. This is another option for purchasing hearing aids that could help with tinnitus. So some examples of this are True Hearing, Amplifon, Nations Hearing. In those instances, the insurance companies partnered with a third party that would provide the coverage and the benefits. So you'd have limited options for where you can go for treatment because those third parties only work with certain providers. So it could get a little complicated here, but don't make it any harder than it has to be. Just understand, does your insurance have a hearing aid benefit? You can call them and ask that. It's very simple. You can ask, does that apply to in-network or does that apply to out-of-network providers? Then you can understand, well, if this only works for certain providers in the network, who are they? And are they any good at helping with tinnitus? Because you can buy hearing aids, but if the person who sells you them, the clinic or the doctor or the specialist, if they don't know much about tinnitus, then your outcomes are not going to be as good if you were to go to an audiologist like myself or others on our team that specialize in tinnitus. A few other points here that are pretty important: that in healthcare, you can either have what's called a bundled service and device, or you can have an unbundled approach. So mostly when you're billing insurance, the audiology services and the medical devices would all be grouped together in one lump sum. So as I said earlier, let's say that working with Treble Health, the total cost for your treatment was $2,900. That would include the audiology services for a period of multiple months. That would include a repair and warranty. That would also include the medical devices that we're recommending. And that's all bundled together into one cost. The way that typically works with insurances is that we would just submit the total cost of the treatment, and that they would, if there was an insurance benefit for hearing aids, for example, then that would be the reimbursement, or that would be the payment. It would be based off of the hearing aids, even though the healthcare is typically bundled together. Unbundled healthcare in this sense refers to if you were just paying for one service at a time or one medical device at a time. Now, some takeaways. Because these things are always changing, insurance plans and coverage, often they change. It's wise to get a list of covered tests and services before you go to that audiology appointment, or just contact the audiology clinic that you're going to for the hearing test, or the ENT clinic, and just ask, do I have a copay for this visit? Usually that first visit, the diagnosis, it's a small copay, and oftentimes your insurance will cover the whole thing. The next step is going to be getting that insurance benefit check to understand what might your insurance pay for tinnitus treatment. Okay. There are many available treatments for tinnitus. That's what we specialize in at Treble Health. That's what this YouTube channel focuses on giving you free information for. Hearing aids or tinnitus maskers are a big part of that treatment. So they're going to help with your tinnitus, and I would recommend trying them if you're a candidate. We can help you determine that in a one-on-one free consultation, right? So that said, when you're choosing these medical devices, when you're proceeding with treatment, make sure that the devices themselves can be programmed well for tinnitus. There's something called tinnitus sound therapy, which means that inside of the devices, you can have certain sounds that are programmed for tinnitus relief. And you need to make sure your hearing aids have that important feature. Otherwise, you're missing out. And you also need to make sure that the professional you're working with knows how to program the devices. My name is Ben Thompson, audiologist with Treble Health. If you haven't already, definitely check out tinnitusquiz.com to get started and get a free assessment and a recommendation for what you should do next on your tinnitus relief journey. I know there are solutions that can help you, so keep your hope and keep it up. Here on my YouTube channel, we'll continue to make videos. Subscribe, check out the video above, and we'll see you soon. Thanks so much. Bye.